Hassan has put it, like it is upon you and I to play our part when it comes to fighting the numbers of COVID-19, but also the situation of healthcare workers in the country. They feel left out in terms of fighting the virus without proper protection in terms of PPEs and also medical cover for those who've been infected. So now I'd like us to join the KMA president. Actually, I'd like KMA president Onyino to join us now virtually for this conversation. And Dr. thank you so much for talking to us here on KTN News Center. So let's begin first with today's meeting. What should be put on the table as the CS chairs today's meeting when it comes to the numbers of COVID-19 here in the country?
Thank you, Linda, for having me this morning. I think through the press briefing we did yesterday through the union and one released by KMA, I think the bare minimum that needs to come out is the protection of healthcare workers in this country, because I think we have shifted focus. We're just now announcing numbers, and you're forgetting that these numbers translate to something. It means increased infections, and it means increased risk to healthcare workers in the facilities. So a bare minimum that needs to come out is how are we going to protect our frontline healthcare workers, and how are we going to ensure that they're actually safe as they provide care to the public.
But Daktari, as much as you're talking about the bare minimums that the government needs to talk about in terms of protecting the health workers, this is a song, if I may put it so, that has been sung month in, month out since the first day we reported the case of COVID-19. Doctors, union officials, nurses, union officials, lab, clinical union officials talking about lack of equipment in terms of the PPEs and also when it comes to the medical covers of the medical officers who are actually at the frontline officers who are fighting the virus.
I know we have issued several advisories that advise the same Ministry of Health. So I think in my own opinion, I think there's a crisis in leadership, actually in the Ministry of Health, because when you refuse to engage the healthcare workers or your front-line healthcare workers as they help you address a pandemic, then it means there's a very big problem that needs to actually be sorted out. Last week, you had a very sad thing. It's like when the NHIF announced that they're going to withdraw cover for COVID-19 because it's too expensive. And you wonder, the person sitting and making those decisions, do they really connect with what is happening on the ground? So there's a clear disconnection between the Ministry of Health and the frontline healthcare workers. And now that you've lost more than 8 colleagues, you're not going to take this anymore. It's either we get back to the drawing board and actually address these issues, or we then face the withdrawal of services from all healthcare workers, where everyone stays at home and protects themselves, because you cannot be willingly exposing ourselves to this risk. And all we hear is numbers and scandals and misuse of funds that are supposed to be directed towards fighting this pandemic.
In fact, Dr. you've just read my mind, because I was about to ask you about the numbers of health officials who've lost their lives, doctors, and it's good you've given us the number to be 8, but kindly give us a ratio when it comes to health workers and patients who've been infected, who had contracted the virus. And this ratio I'm talking about, the ratio of infections and deaths.
Linda, we're actually collecting this data today, and which we'll be able to provide to you. But, already we are starting from a place where we don't have enough doctors in this country. Several parts of this country don't have access to a healthcare worker. And here we are losing not just doctors and healthcare professionals, but very senior specialist doctors. These are doctors that take more than the total of cumulative 12 years to train. So these are resources that you cannot continue just putting them as statistics and saying that everyone is being affected and we are losing everyone else. So it should not be very unique to doctors. And in fact, today, what I heard that the head of the health committee in the Council of Governors, Mohamed Kuti, who's a doctor, is very unfortunate. In fact, it's a matter that we may need to sit down as the National Governing Council of KMA and see whether we should expel him as a member of KMA, because it's unfortunate for such kind of thinking to come from someone who's supposed to be leading. So leading the healthcare service at the county level.
And so, Daktari, so where are we as a country in terms of our safety and reducing the numbers? Because if our foot soldiers are being hurt, then it should be a worrying problem, concern to the government and Kenyans at large.
It should be a worrying, it's actually a worrying, it's a dire situation. We walk around all our institutions. Linda, me and you, if we get sick today, I can assure you we'll struggle to get an ICU bed in this city or anywhere else in Kenya. We'll basically just have to pray and hope that the infection passes and we survive. So the current situation is dire. That is not coming out clearly from the press briefing we're getting. And the protective measures that we need to take, even in our institutions, to protect the healthcare workers, is not happening. You go to our clinics right now, people are crumpled. The clinics are back to normal, which is unfortunate. There is no screening in our institutions. Visitors are back to hospitals. We are performing surgeries without screening the patients that we are screening. And this just leads to more and more risks to healthcare workers who are there to protect you. Now, with the numbers that you have lost and you're continuing to lose, and the more than 100 who are in isolation and in quarantine, it means there's service disruption in our institutions. So we need to come back to the drawing board and focus on issues that matter in this country. We need to discuss issues health. We need to actually ensure that we are handling this pandemic well, so that then we can have time to discuss any other thing that we need to.
All right. So, Daktari, what can you really tell us? You know, are we really on a second wave, or we are yet to experience the second wave because of these high numbers, or the high numbers is because of the fact that the president partially opened the country in terms of entertainment joints, children have gone back to school, and offices, people are slowly reporting back, you know, for work?
I can't say we're in a second wave. I disagree with that. I think we are actually peaking, and if you look at the modeling and you visit the advisories we gave earlier, the projected modeling was by November, December, we'll actually be peaking. We are doing more testing now, but what we did, in as much as we open up the country, there was no proper contact tracing. We were not testing and tracing and isolating those ones who were infected. So we left them to go into the community. Now we are at the level of community transmission. Everyone who you meet on the road is a suspect. So because of not continuously emphasizing and enforcing the public health protocols, the political rallies that we saw, the increase in gathering, opening of schools, which we are a bit coy initially, and you can see now in schools you have a lot of infections now coming up, then all these combined together is what now you're seeing. So you cannot really say it's only because of restaurants and bars or schools or the political rallies or opening up the country. It's a combination of factors. And this backstops at the Ministry of Health, which has refused to engage the frontline healthcare workers in terms of coming up with innovative solutions to properly handle this pandemic. You cannot be leading the health sector and you're not talking to the your soldiers.
So, Dr. when are we likely to have the second wave then? Because from your explanation, it looks like, and you've actually said it, we're not on a second wave as a country.
I think we are into this deep into next year if we do not come to our senses, sit down and come up with proper measures to actually address this pandemic. And you're seeing all over the world, the same thing is happening, where we are now, they're in the second wave, them they started earlier, us we are peaking, and we are going to a second wave very soon if we do not take radical public health measures to help address this.
All right, and Dr. as we wind up this conversation, I'd really like to get your thoughts about the vaccine that even Health Cabinet Secretary Mutahi Kagwe has really caused doubts about it.
I think what we need is a vaccine. The Pfizer vaccine has been shown scientifically to be more than 90% effective, and we need health professionals and professionals in vaccinology to speak about vaccines. And I think that utterance is very unfortunate coming from the leadership of the Ministry of Health. That we can even fast track and have healthcare workers get vaccines. This has happened in China, it's happened in Brazil and Portugal, where we have frontline healthcare workers being vaccinated so that they can provide care as we wait for the definitive vaccine from the government.
All right, thank you so much, Dr. Were Onyino, the president of the Kenya Medical Association. That is came here talking to us about the rising numbers of COVID-19 in the country and also that expected meeting, that of COVID-19 meeting that will be chaired by Health Cabinet Secretary Mutahi Kagwe. Wait to see what that meeting will be all about. So far, it's about COVID-19, but what decisions, that meeting will come up with, especially when it comes to the containment measures of COVID-19 in the country. But barely asked to the education sector stakeholders meeting, seeking answers actually to the way forward in the COVID-19 era. Kabarnet High School in Baringo County has joined